Hello, I'm Steve Solomon. I'm the Assistant Director of the Health Safety Environment Department, and I have the honor and privilege of co-facilitating with Brother Tom Duffy, one of the Safety and Health Specialists in the Health Safety Environment Department.
Thanks, Steve. Today we're going to be talking about some of the resources the USW has been working on to help guide you through these difficult times. This will be a short overview on the topics covered by two of the fact sheets that are located on the USW website. A guide for USW local unions still at work, and recommended controls to reduce worker exposures to COVID-19. These two fact sheets can be accessed by logging onto our website, usw.org/COVID-19. Both of these documents can be downloaded, printed, and shared. For those working for employers that have been identified as essential businesses and don't have the option to stay at home, as most governors have ordered, there are some things we think you should know about how to protect yourself, as well as maintaining a safe working environment for everyone. The USW and employers continue to negotiate safety policies on COVID-19 to help employers maintain safe workplaces. Workers with pre-existing health conditions such as diabetes, asthma, heart disease, and compromised immune systems, or older workers that have higher risk of complications if they were to contract coronavirus should be encouraged to stay at home. Temperature checks with no-touch instruments are one part of an overall infectious disease program. The screening only identifies workers who are symptomatic. COVID-19 spreads mainly among people who are in close contact within about 6 feet for a prolonged period of time. Self-isolation or quarantining is needed for workers that may have developed symptoms or have been in close contact with someone that has tested positive. Quarantine is used to keep someone who might have been exposed to COVID-19 away from others, while isolation is used to separate sick people from healthy people. Sick workers should stay home according to negotiated leaves of absence without fear of discipline. Workers that fear discipline for missing work when they are sick may feel pressured to come into the workplace, which in turn could further spread the virus. Workplace evaluations must include workers and their representatives to achieve social distancing. Since people can spread the virus before they know they are sick, it is important to stay away from others when possible. When cleaning and disinfecting, follow the manufacturer's guidelines found in the safety data sheets to adequately kill viruses. Workstations must be inspected by workers and employers to ensure they have adequate room for social distance, and shared touch points are part of a cleaning and disinfection plan. Workers must be trained to understand the use and limitations of assigned PPE, including proper donning and doffing to prevent additional exposures. And do not fall for false remedies found on social media and the internet. Currently, there is no vaccine or treatment that will prevent or cure COVID-19. This fact sheet also contains other helpful web pages you can use for additional information, such as the AFL-CIO, CDC, and OSHA guidelines. Now I'll turn this over to Steve Solomon to talk about our second fact sheet on recommended controls to reduce worker exposures to COVID-19.
Thank you, Tom. USW continues to identify and support COVID-19 health and safety controls to assist in slowing and stopping the likelihood of workers contracting the virus. Some of these control measures are in place at USW represented workplaces, and in some locations, they are working on implementing these controls. Congratulations to local unions involved in the implementation of the control measures. USW is sharing what we have learned, illustrating how the hierarchy of controls put into practice protects our members and others in our workplaces. Although particular controls may not work for all workplaces, we will continue to monitor and share controls as a way of exchanging experiences, ideas, and insights for safer workplaces, as well as building collective approaches and a stronger union. This fact sheet has 5 sections: action plans, engineering controls, administrative controls, personal protective equipment, and additional information. I will provide a quick overview of these sections. Action plans. Each workplace needs to develop an infectious disease preparedness, response, and control plan with worker and union involvement, including a section for potential spike in infection rates and action plans as the economy is reopening. Some workplaces are or will be returning to work. Prior to startup, a management representative from the location should acknowledge that the action plans have been put in place and implemented. Employers, workers, and their representatives must assess jobs and tasks for physical distancing and respond appropriately. Engineering controls. When hazards cannot be eliminated or a substitute is unavailable, the next most effective level of protection for workers is engineering controls. The USW has learned about various controls that help eliminate high-touch areas and increase physical distancing. For example, the use of touchless faucets have eliminated high-touch areas. Some workplaces have discontinued the use of touch biometrics and are now using other means to clock in and out. Noise-canceling headphones with a microphone are being used to increase social distancing. There are many other engineering controls you will find in the fact sheet. As we move through the hierarchy of controls, administrative controls includes items such as policies and procedures, training and education, cleaning and disinfecting schedules and practices, social distancing, and more. Personal protective equipment, or PPE, is the last line of defense, but for those who need it, we want the best that money can buy. Workers using PPE must be provided with training and procedures on the proper use, care, and limitations. USW continues to ask for your cooperation in donating N95 respirators and other PPE to healthcare workers on the front lines. Additional information. Cloth facial coverings are only one part of a comprehensive infectious disease prevention and response plan. Cloth facial coverings do not do much to protect the wearer. However, a cloth facial covering does help protect others if the wearer has the virus and does not know it. For additional information, please refer to the fact sheet and other resources on our COVID-19 webpage about cloth facial coverings. The USW will continue to share controls and practices as a way of exchanging experiences, ideas, and insights for safer workplaces, as well as building a stronger union. Now, I'll turn this over to Tom Duffy to close our presentation.
Thanks, Steve. If you have a question, would like to sign up for updates or report a health and safety issue related to COVID-19, please log on to usw.org/COVID-19. You will also find other web links to various resources that may not be covered in these fact sheets. Please continue to work through your local union, staff rep, and district director. For non-COVID related safety questions or concerns, you can always contact the Health and Safety Environment Department by emailing us at safety@usw.org. Continue building our solidarity for safety and healthy workplaces. We thank you for your time. Solidarity forever.